everyone. I'm Dr. David Ajibade with the Brain and Body Foundation. Welcome to Your Health in Your Hands. We will be continuing our series on cancer, and we have with us none other than Dr. Ijoma Mbadiwe of Life Hospital and Medical Spa, and you're doing some fantastic things there. I just want to say thank you again for making the time to join us on this show.
Thank you for inviting me.
So we've spoken about breast cancer, we've spoken about prostate cancer, the two most common types of cancers in males and females. But then the next one, colorectal cancer, which is the next most common of the two in the different sexes. Why is that a problem? And tell us a little bit about it, especially with regards to Nigeria and the rest of the world.
Okay, colorectal cancer is quite common. They say it's second to, in men, prostate or lung. You know, unfortunately in Nigeria we don't have statistics. Then in women is, you know, next to breast cancer. The colorectal cancer, why it's very important is that people miss it. People present very late. Okay, because if you see somebody with hemorrhoid for so many years, you will just be treating it as hemorrhoid. It doesn't know that this can be colorectal. And
then by hemorrhoid, we talk about pile. So something is sticking out of the rectum, the anus. And sometimes it bleeds, so people just think it's just a normal pile.
But I've had it for a long time, so it's okay. So people just ignore it. Okay, but colorectal cancer is one of the cancer that metastasizes to the liver easily. In fact, it can go to pancreas, it can go to spleen, anywhere. It can go to bone.
So it spreads very rapidly.
Yes.
But the thing about the colorectal cancer too is that you don't really sense any changes per se. You feel like, okay, maybe you feel fuller than usual, but hey, you're getting older, so your appetite reduces. It's expected that you get full from time to time, so you don't really sense that something is going on, except when you start having clear blood in your stools and you say, oh, there's something going on here. But for the most part, at the earlier stages, you don't really feel much.
Okay. It presents late.
Okay. Any age group particularly that it's more common amongst?
Most of the time it's the same age group, older people.
Older people. Why do these things always happen to older people?
I know, after 50, because they can be getting away with eating junks and eating food that are not.
When our bodies are still strong, we can take the insult. Our immune systems are working better.
After a while, the immune system is not working well. Our body are not that strong, so they won't take the insult. They show up. Okay. So colorectal cancer, we can talk a bit about the screening.
Okay.
Colorectal cancer, I think if you have a family history of colorectal cancer, start screening at age 40, 50. Okay. And I'm not talking about an expensive screening. Just take your stool to the lab to do what they call occult blood. They will just check whether there is an occult blood in the stool.
Occult blood.
And if there is occult blood in the stool, then they can tell you to go and do the expensive test called colonoscopy. That is using a camera to go through around your colon. Okay?
To really examine the walls to see if there's anything
there.
Is that available in Nigeria though?
Oh yes, very available.
Okay.
And then if you have a pile or hemorrhoid for a long time, don't just say, oh, I've had it for 10 years. Go and check and make sure it's normal pile, you know. And if you want to operate on it, tell the doctor to do a colonoscopy first to make sure that there is nothing above before you just treat the local pile. Because the pile operation is one of the most painful operations you can think about.
Oh, wow.
So so that is about the screening. You need to screen. If you screen early, if you pick it up early, and it's almost curable. But at times it's very aggressive. you know, because I think we pick it up very late.
Yeah, on average, we pick up a lot. Most of the things that happen in cancer in Nigeria, they're very late presentations. Initially, they're in denial. Even they may suspect it is, but no, it's not their portion. They want to tell them, go and pray about it. They want to Babalawo, traditional medicine, and so they probably make them all kinds of promises, and the years pass by, and eventually, when they see that everything else has failed, that's when they now come to the doctor, and by that time they expect the doctor to perform wonders. And it is a story that just keeps on repeating itself.
And then for colorectal cancer, diet is very important.
Yes, let's talk about that.
Diet is very important.
Okay.
People who don't take fibers in their diet.
Fiber. Very important, yes.
Very important. You must take fiber. Don't take processed food because there's nothing fiber in it.
Right.
You take fibers, a lot of vegetables, a lot of yams, sweet potatoes. You know,
I think the thing about fiber, fruits and vegetables, because the thing about fiber, and I'm a very big proponent on fiber, and probably we'll talk about it a little bit in the next session, but really quickly, the body, nature hates a vacuum.
Yes.
Folks, nature hates a vacuum. And also, nature hates, probably even more so, nature hates stasis. Anytime things are not moving like they're supposed to be moving, if your body isn't moving like it's supposed to be moving, you're at risk of getting clots. If your urine isn't coming out like it should and it stays there, bad stuff can happen to it. Same thing.
Urinary tract infection.
Urinary tract infection. Same thing if your gut, if you're not pushing out on a regular basis, if you're not, as you're eating, you're not evacuating on a regular basis, you're going to be in big trouble.
Yeah.
There's a big risk of having all kinds of things, from cancers to ulcers to even infection that can spread to your other parts of your body. So we're going to talk about some of these dietary things in a few minutes, but just don't go away. We'll be right back. All right, welcome back. We're talking about colorectal cancer, and in the last session we started talking about fiber and the care of your gut. Movement. To me, that's the ultimate law of life. Really, if you're not moving, if your body isn't moving, you're on the way. You're on the way towards an untimely end.
Yeah.
So, and I read somewhere too that about 40 to 60, I'm not sure now, but 40 to 60% of all cancers really start in the gut, in the digestive system.
Yes.
Do you agree with that?
About 40, yes. Okay. I agree with that. Yeah.
It's affected by the diet and
diet, because people, and that's how colon hydrotherapy came about.
Okay.
You notice that even our mothers, when we were small, remember, they would line us up on Saturdays and give you castor oil and everything, because they know that if you have a clean gut, you grow better. So
it's just innate grandmotherly wisdom.
Yes, they do that, and they sense that, and they know. So we should be doing the same thing for ourselves. We need to do colonic cleansing all the time, if we can,
And colonic is primarily a way by which it's like a pipe or a tube that is inserted into the anus.
Yes.
And
goes until it comes to the cecum near the appendix.
Wow, it goes all that way.
Yes.
Wow.
So because you have transverse,
ascending, descending,
transverse and descending colon, and then the rectum.
Right.
Okay. So it goes. It's quite long.
Wow.
So it goes all along. Yes.
And that helps to cleanse out the colon primarily. That's and so all those that buildup of toxins of undigested food that hasn't found its way out, the bad stuff, the bad worms and all that, it can help cleanse it out. And then of course, just in case it takes out the good stuff as well, you also give probiotics, which are good bacteria to help to repopulate the gut.
Yes.
And I think we need to do an entire session on
just
probiotics and the care of the gut and all those things. All right, so back to fiber. And I agree with you. There are cultures that colon cancer is absolutely, it's not even is unknown in the communities, and a lot of that is because of the high fiber in their diet, whether it's sweet potato or other kinds of yams or just vegetables that they take. Doesn't matter if that vegetable is cooked or not.
It doesn't.
Okay, so whether cooked or not, as long as they are taking the fiber in, they're taking. So that's a big thing, folks. I cannot overemphasize that. You've got to take. I think about Nigeria and fluids. But I think about Nigeria. I think about how little access. We don't have enough oncologists. We don't have enough. Certainly, we don't have enough treatment centers. We don't. Sometimes the machines break down. It just seems much more important that we understand these fundamentals, these basics,
preventive
medicine,
which is better than cure.
But even when you have the disease, there are still things that you have to do along with your oncologist. Your oncologist, like I always say, let your doctor take care of your illness. You have to take care of your health.
Yes.
Because the doctor is focused on that disease. He's focused on getting that disease out of you. He may not always do everything to help you rebuild your strength.
Yes.
So that's your responsibility. So talking about fiber, talking about probiotics, water, fluids to flush out the toxins. In addition to all those things, any other thing that you recommend? But let's quickly talk about what the conventional approach is. So to treatment. So we talked about doing the tests.
Yes. Okay, let's do the screening. We've talked about the screening.
We said occult blood and then colonoscopy. Anything else that we need to look at?
Now, if you have a pile, just go and do colonoscopy to make sure there's nothing up there.
Okay.
Yeah.
Okay.
So don't just call it pile. I've had it for 10 years, so it's just pile.
Don't take things for granted. Don't take things for granted. Especially if you have the means to do those tests.
Yes. Yeah.
All right. So, and then of course, might have to do an ultrasound. The doctor may have to do an ultrasound to check your liver, your kidneys, make sure there's no spread.
Yes.
CT scan and all those things.
CT scan, double contrast CT scan, things like that, to make sure that there's no spread, and to make sure that you're not obstructing. Because if you're obstructing, there's a different kind of surgery that you need than if you're not obstructing. Obstructing
means that if there's no blockage anywhere in the gut that is causing that's obstructing the flow
of the food.
Food, and digested food. Okay. And so let's go on to treatment.
Okay. Treatment, the first thing is probably surgery. Most times it's surgery they do for the orthodox doctors. Okay. And if you have a blockage, they will do operation they call colostomy.
Okay.
They will bring out your gut out till probably when they treat you with chemotherapy, the blockage is open, they can put it back.
Okay.
Occasionally it doesn't happen because the person might have died before then. So that's the treatment. And another is chemotherapy. Chemotherapy. They give chemotherapy to try and, depending on the stage, because let's be frank with ourselves, chemotherapy at a very late stage most times don't help anybody. But at the at the early stage, you can treat the person completely. You can go into long remission.
Okay.
But when it's too late, it's gone to everywhere. It's gone to the liver. It's gone to. The more you give the chemotherapy, the more ill the person is, and then radiotherapy as well. Okay. So that's it. Then we have the other ones, the orthodox, the integrative oncology, who believe that you can do a lot without.
So we're going to hold our thoughts now because we have. I want us to I want an uninterrupted attention on that. So there's chemotherapy. There's the surgery where they remove. The affected parts of the colon, and then there's the chemotherapy and the radiotherapy, and I understand it can be very, very intense and can really wreak havoc on the system. Again, I would want to say too that even as these things are happening, you always stand a greater chance of survival if the patient is also taking the right kind of nutrients that will help to build his body without it affecting the treatment. Because I think one of the things oncologists are always very upset with their patients about is that the patients go and find something and they're like, they hear about it on the internet and they do it. Meanwhile, that's very thing is compromising and sabotaging the treatment that the doctor is giving, and this kind of makes a lot of oncologists really mad. But however, I don't think we should throw away the baby with the bathwater, because some of these other quote unquote, I don't want to use the word alternative, but maybe complementary approaches will help in terms of long-term survival and success of the treatment. So there's a balance to be had, and I'm sure we'll get to that in the next session. So folks, don't go away. We will be right back. Welcome back. We are talking about colorectal cancer in Nigeria among black people. And we've said a few things, but we're going to be focused in this last segment on treatment, especially from a complementary integrative approach.
From the integrative approach, integrative medicine is complementary, alternative, and some good part of the orthodox medicine. So it's not just complementary or alternative. And in that, they believe that if somebody has cancer, you need to first of all clean the person out. Because the person will have heavy metals in the body, will have all sorts of toxins and all that. So you clean the person out. We have different things to use, like ozone, colonic irrigation. There's a machine that I have that has ozone, oxygen, infrared, and steam. So this machine will detox you as well as help you to build up your immunity.
Fantastic.
Because the ozone is a powerful oxygen. It's a type of oxygen, but it's 3 oxygen in one. As opposed to
oxygen that we breathe is O2, ozone is O3. Is this a gas as well, or is it a gas?
It's a gas. So most times they use it all the time. They use it rectal, they use it to drink water, they use it IV, they use it in your blood to help with cancer. And the integrative medicine, they have drugs that are phytotherapy, kind of supplements, but there are supplements, supplements that are pure,
and potent, more concentrated.
They use it as well, because they don't do surgery, but most of them are not averse to surgery. If you want to do surgery, you do. And remember, like I said to you, most of them do chemotherapy now, but they do it in such a way that they need just 10% or 15% of the chemotherapy. So just enough to kill the cancer. So they are not averse to chemotherapy. What most of them don't really like is radiotherapy. And there are so many machines available now, what they call hypothermia. This hypothermia machine is, you put the person on it, it takes the temperature to about 42. It's like you having fever. And the body will say, okay, he's having fever. Let me come and help him with immunity to fight this fever. So something like that. So it kind of triggers the immune system as well. Triggers the immune system. So the heat itself, does it kill the cancer? It kills the cancer. It kills the cancer a bit, but the most important thing, it triggers the immune system. Because you just, what they think is the body can heal itself. Do things that the body can heal itself. And like we're saying, you can have other things you can do. Things like turmeric is available, things like turmeric is like an anti-inflammatory. It's anti-inflammatory, so it helps with diabetes, cancer, hypertension, everything. And curcumin.
Let me just quickly jump in here now. I want to send out the stern warning. In all these our talks about cancer.
Yeah.
We talk about all these other things like supplements, and she just mentioned curcumin and turmeric. These are not what you just go and do on your own
and think it will cure it.
Don't do that.
Don't do that.
That's silly. That's stupid.
Make
sure you go to your cancer doctor. Let them treat it the way it should be treated.
Yeah.
And if you can find an integrative oncologist, do that as well. But make sure you're getting professional help. Don't do it.
Don't go to the market and say,
okay, I want to go and get turmeric, and then you're like, I want to survive.
Yes, I want to survive. Okay.
Or just go and pray and then not deal with this thing.
Yes.
There are too many cases of people failing and doing all that and failing. So please don't be a statistic. Do the right thing.
Yes.
Right? Just so that.
And another thing I want to tell anybody who has any illness is that the integrative medicine, they believe in holistic treatment. They believe that you're going to treat the body, the soul, and the mind. Okay? So if you have an illness, there are blockages somewhere. If you have unforgiveness in your spirit,
that's a very important point.
You need to go and sort it out. If it means going to apologize to the person, I'm sorry, I was the wrong person, just to have that, clean heart, because it blocks your system, So you need to have a being you believe in. If you're a Muslim, the Muhammad, if you're a Christian, God that you believe that can help you go through this illness.
That can't be overstated. In fact, they've been doing so many studies in the US now about how the place of spirituality and religion in illnesses, in stress, the ability to withstand stress, and even in cancer and all those things. So absolutely, I key right on this, the importance of the spirit, the soul, and the body, and the ability. And there are some centers in the US that actually imbibe all these things together, and they have tremendously higher success rates than the regular cancer treatment centers do. So folks, we've not been able to cover everything, and our producers are telling us that the time is over already. So we're going to have to wrap it up here. But again, cancer is not the kind of disease that you want to joke with. Make sure that you go and seek professional attention, and any other thing that you learn about that can help, then make sure you check it out with your doctor to make sure that you're on the right track. Don't take something that will sabotage the treatment and therefore you lose your life. So very, very important. But as always, we ask you to stay tuned, stay with us. If you have any questions, send them send your comments, questions to the social media platforms, and we shall be there to hopefully answer those questions for you. I'm Dr. David Ajibade. Dr. Ojoma, by the way, thank you so much again for having us, for coming on.
Thank you for inviting me, and thank you, viewers, for listening.
It's always a pleasure, always a pleasure. So folks, stay tuned. Your health in your hands. See you next week.
Yeah.
Bye.